We're talking today about caregiving, and I'm really pleased to welcome Paula Wolfson, who's the manager of Avenidas Care Partners. This is a big, growing problem in Palo Alto, and I really appreciate you being here so we can kind of unpack it and discuss what's happening. So thanks for being here.
Well, thank you for having me, and thank you for the great coverage in today's paper on our Caregiver Conference. Thank you.
We'll talk about the details of the conference soon. I kind of want to start by asking you about the scope of the caregiver issue here in Palo Alto. I understand that soon 1 out of 4 people in the county will be seniors, so I know that a lot of people need to start planning ahead if they're not already caregiving.
Yeah, it's interesting you brought up data, because I've been here since 2012. When I started running the groups at Avenidas, there were 2 to 3 to 4 people in the groups, and they were separate groups. We had adult children in one group and spouses in another. And then I merged them, and I ran one group because I like mixing the ages of the caregivers. So some people are caregiving in their frail older years, and some people are doing it in their 40s and the 50s because their person has a early onset of an illness. So the groups have grown in these past few years, and I would say in the last year, they have really grown. So for a while this past year, I was doing 2 groups a week because it's hard to have a supportive conversation with 15 to 20 people in the room, and we were hitting numbers of 20, 23.
Oh my goodness.
And we do keep track. We have to report data to the county on our groups. We're partially funded to the city for providing the service, so we keep data, and we're now providing services to hundreds of caregivers of really all ages.
Yeah. So what is your role exactly in managing this Avenidas Care Partners program?
So Care Partners is a counseling program. It's an elder care consultation program. I'm an LCSW social worker, which is the highest leveled licensed social worker that one can obtain. And so I meet with clients in their homes. I will meet with people in the hospital. I help advocate for them to navigate healthcare systems, transitions in the care as a person moves from an early stage of an illness to needing professional help, caregiver help, to possibly needing placement, to then end-of-life planning and hospice placement. So during each phase of change in a person's level of care, what the family caregiver discovers is that they need help. So I will provide resources and referrals to services and community partners. I have a lot of community partners, and many of them are speaking at the conference. And then I do a lot of emotional support with family caregivers who are overwhelmed, stressed. They need to be reminded to take care of themselves. I encourage them to see their doctors. And we also do a lot of phone counseling. People call us on our information assistance line, and I receive phone calls from people all over the country. Adult children who are in New York or Florida. If my phone rings at 9 in the morning, or I see the red light is on and it's Monday morning and I'm there at 7:30, 8:30, I know it's an East Coast family. They're already up and they're worried.
Yeah. And how have they heard about you or specifically? Or?
We have a wonderful marketing department at our lovely senior center, and Carrie gets the word out. She's our marketing director. So we have a presence on the web. And then a lot of families know us by word of mouth in the community, and also people here have moved and get jobs on the East Coast, especially the tech world is everywhere now. And we're also seeing families from other countries.
What are some issues you see that are unique to the Palo Alto area that are impacting caregivers?
So one of the, what happens each week in the caregiver circuit is people talk about their problems. And most of my caregivers reside in Palo Alto. Most of them are women. There are a few men. And so the issues I hear reflect my group's experiences. And this is what I hear. It's hard to retain a home care agency caregiver if you only need 2 to 4 hours versus 8 to overnight, because the jobs pay so low that the agency caregiver wants and the agency wants to serve somebody who needs longer hours. So it's complicated in that if your person needs only 2 to 4 hours, it's hard to get the help. The caregiver themselves may change jobs frequently so that they have more income. So it's very hard to retain caregiver agency help in a way that you've built a relationship with the caregiver, the paid caregiver. So a lot of folks in my group are trying to always weigh, do I hire privately or do I hire through an agency? And then how do you vet the person and make sure that they're skilled? There are issues with women, family caregivers having to leave their jobs early because their loved one is sick and they can't afford the caregiver. And so they become it, and then they are not accruing their Social Security benefits as much as they were continuing their careers. I've heard from my caregivers in my group that they are house rich and cash poor. So the higher cost of co-pays, of hearing aids, eyeglasses, medication, transportation, that really adds to that family caregiver's budget, and the cost of caregiving is expensive. So we're having a session in the conference on the cost of caregiving to talk about that.
I hear the financial aspect is huge for people. Are there other types of experts that families need to liaison with, attorneys and accountants, in order to manage this caregiving?
Yes, so we're community partners with a lot of attorneys, elder state attorneys. There's several in our area. Deborah Radin will be speaking at this conference, and she makes it a point to have people really proactively plan. So even before the caregiving role has begun, we suggest the 40-70 rule. So the 30 to 40-year-olds in the family sit down with the 70 to 80-year-old parents, and they plan and they organize their documents. And the first thing they talk about is their durable power of attorneys and who will be making the health and financial decision making if the person cannot do that for themselves anymore. So we talk about that early because that impacts who's managing the budget, who the guardian is. We're having a session on navigating healthcare systems. So Dr. Rita Katak, who's been the director of aging and adult services at Stanford and who's just amazing and one of our community partners, is doing the session on continuity of care. And that also impacts budget because if you're in a hospital, if you're in a nursing home, if you have home physical therapy and it gets cut off too soon and you fall and you break your hip after you've been in the hospital and after you've been in rehab. I have clients whose loved ones have broken their hips in hospice. So there's a lot of proactive planning that needs to happen with how you navigate these systems so that you're also making sure your loved one is safe. Now, these are things that are actually discussed about in my group. I'm not making any of this up. And the cost of the person going through all of that, going into hospice and then going back into the emergency room because they actually need to have that hip and the pain taken care of is expensive. And the medical providers are very concerned about this too. This is why when we have this caregiver conference, it's all this wonderful energy from the legal world, the medical world, fiduciaries who help. The woman, Minda Kushner, who's doing the cost of caregiving, is a fiduciary and she does planning. She helps people really plan, and she will actually help people work with their budget and go through their paperwork and take on the role of helping people each month. She has clients that's what she does.
I'm wondering if caregiving and the experience of caregiving is somewhat like disaster preparedness, where we all know we should be doing something ahead of time and nobody does, and then, well, not nobody, but very few people do. Do you find people are actually prepared?
I think that's a worthwhile analogy, and that's something we have to talk about too with our caregivers in this area is disaster preparedness. We have sessions on calling 911. A lot of people don't know what to do when they pick up the phone and call 911 and how to even prepare for that phone call, which is if you do have somebody who's sick at home, you have medical records handy, you have the advance directive handy, you have a post, a document you sign with your doctor about what your end-of-life wishes include. There's a lot to prepare for, yes.
Yeah.
It's a good
Sounds
question.
like it.
It's a good question.
You had talked about a need to have like a coordinated effort between the city, the county, the state. Can you talk about that a little bit?
Sure. There has been an effort out of the World Health Organization that has spread all around our country called Age-Friendly City Initiatives. And then that's also now including dementia-friendly city initiatives. So I'm on committees with City of Palo Alto, Human Services, and we meet once a month and we plan programs and events to promote age-friendly awareness and dementia-friendly awareness in our city. And it's relatively new. We're still in the beginning phase of this. They recently showed a film on proactive aging, on positive aging, on awesome aging of about 50 different folks. And we did another session where we met with city employees to train them to be aware of when somebody comes in to pay a utility bill or they're in the library and they appear confused, how to respond to that and what do you do? And so we were educating the participants. We had about 150 people from the neighborhoods of Palo Alto in the room with us. And most of them did not know that they could call the police for what's called a welfare check. If you're concerned about a neighbor you haven't seen and their mail is piling up and it's an older person next door to you and you just haven't seen them, that it's better to call the police and have them go knock on the door to do a welfare check. And then if you're very concerned about somebody who is telling you they're on their computer, as an older person, and they just donated $10,000 to a charity, and you hear this story day after day, and they're depleting their money, that possibly would result in a call to Adult Protective Services, because there is a lot of financial scamming going on now.
That sounds like a great idea to kind of spread the awareness throughout the community. Is there any kind of next step that needs to happen to continue that progress?
I'm a next step person. I'm somebody who wakes up at 3 a.m. with ideas of, I want us to do this. Who can I get? So I would like to see in Palo Alto, because I think we have the potential here to be a really model city on proactive aging and age-friendly services, is a family caregiver census survey. I want real numbers of everybody in our city, block by block. I want a block captain for caregiving, just like we do have block captains for emergency preparedness. Good analogy. I would like to see every block, people know who their neighbor is, and just a little bit of if they need help, if somebody's hospitalized, if they can share transportation, maybe have play dates. So if you have 3 people on the block and they're caregiving with somebody with early stage dementia, get them together and give 2 of the caregivers time off, 1 of you stay, and that block by block, people start organizing this. I think it's going to happen. I hear it's happening a bit naturally within my caregiver support group. People have met each other, people realize they live near each other, and they start doing things together.
Harnessing the power of the community, the neighborhood.
Well, it's the power of the community, but also because Palo Alto, we are in the heart of those who want to pioneer the aging space with technology. That's the phrase I've learned from my young tech friends, that they are pioneering the aging space.
Okay.
And that they're working on solutions for all of us. Yeah. And I want them to team up and create a survey and then find a brilliant way to survey everybody who has a computer or a laptop or a cell phone and find out what they need. I don't think we really know what we need here in Palo Alto. We have extrapolated data from the Center for Disease Control and from other surveys that then people make assumptions about what we have here. I think we could do this. I think it just has to be a concerted effort. But I think we really could do it.
Yeah, that sounds reasonable. How do you know what you need to provide strategically if you don't know where your starting point is?
Here's what we do know about the increased numbers of caregiving needs. We know that when members of my caregiver group have called to schedule a cognitive status exam with a neurologist at an area health provider, that they're told a month, 2 months, 3 months. They're backed up. Those cognitive status exams, the in-depth ones, are critical because they're the ones that give you the information about executive functioning issues, impulse control. Possibly you need an MRI. The first step for anybody with memory loss is, at some point, is going to be a thorough cognitive status exam, not the mini mental, which is a 15-minute. I do not recommend those anymore. And I'm hearing from my family caregivers that they have to wait. So one of my community partners, who is a geriatrician, has created a solution. He just opened up a clinic in Los Altos called the Geriatric Clinic. This is Dr. Ayati. Ayati, Dr. Ayati, and it's not. He is a supplemental, a secondary service. So he's not replacing anybody's primary physician. But if you are being told there's a delay in a service for instance, a cognitive status exam, if you think that your loved one is taking too much medication or it's not quite working together, and you're concerned about that, he's a problem solver. So he is now in practice. It's brand new. It's really literally very brand new. So for people who are told they have to wait or they're having problems and they really need help, he has a practice now where he's the director. He's a geriatrician. He has a geriatric psychiatrist and a geriatric psychologist, 3 of them on board. And that's gold. That's amazing. I don't think that exists anywhere in the country right now. But he is using Stanford technology, community partnerships to take care of and resolve problems.
Together. Yeah. If someone has a diagnosis, at what stage do they call you? At what stage should they call you?
People call me when they notice something has changed and the person's functional abilities are changing. So you can have a diagnosis of early stage dementia and even Alzheimer's, very early stage, and people are still driving. It sounds scary, but the issues become significant when your behavior is changing so much so that you can't find your way home. You really shouldn't be driving. You put your cell phone in the freezer. You cannot dress yourself properly. And the behavior is, you're not safe. And that's when I get phone calls. But I would like to get phone calls when it's just the family is deciding to talk about things and everybody's competent and can plan together. That's the best.
Mm-hmm. So about the Caregiving Conference,
Sure.
Can you tell us some of the details? When is it? Where is it? What's on the agenda?
Yeah, so the conference is November 10th, a week from tomorrow, and it's right downtown and at the Palo Alto Mitchell Park Library in the Conference Center.
In South Palo Alto.
Downtown Palo Alto, Middlefield Road, and we'll be meeting it starts off in the big room, in the Palo Alto room. So registration begins at about 8 in the morning, and we take walk-ins. So if you're just now hearing about this for the first time and you want to go, we will accept you as a walk-in. That's fine. But otherwise, you can register online. You can go to www.avenidas.org, and all the registration and the brochure and the lists of all those sessions are there. So the theme is creating your master plan. I've been thinking about master plans now for a while because I think the only master plan you can have as a caregiver is to take care of yourself. That you can control. And caregivers need to take care of themselves first. So we want to talk in this conference about empowerment, resilience, stress reduction, coping with grief, and we call it anticipatory grief because if you're caring for somebody who's changing, there's a grieving process that's going on while you're still caring for them. So we're touching on those topics. And the way the sessions work is that there are 9 sessions. There are 3 time slots, so caregivers can go to 1 session per time slot. So by the end of the day, you've gone to 3. And I've divided them into choices about the emotions of caregiving. So there's empowered caregiving, which I am doing. There's one entitled It's a Marathon, Not a Sprint, which is going to be about renewing your energy, stress reduction techniques. And then we call it Caregiving, Care Grieving, the one about anticipatory grief. And all of these sessions are facilitated by social workers. So 2 Avenidas social workers, and then Christina Irving from the Family Caregiver Alliance is doing It's a Marathon, Not a Sprint. Then there are sessions on legal health and financial proactive planning. So the one on elder estate planning is in the morning with Deborah Radin, and then in the mid-morning is hospital to home goals of care, which is on healthcare resources, services, and advocacy skills for family members to learn how to navigate their way and to really support continuity of care. That's the goal.
Yeah.
And then during that time slot, or not time slot, but during that series, the cost of caregiving. So they'll have choices. If you have issues with organizing your documents, you would want to go to the elder estate session. If you are dealing with somebody who's frequently hospitalized, you would want to go to Dr. Gatak's session on continuity of care. If you're struggling with the cost of caregiving, you would want to sign up for Minda's session. And then there's a series of sessions on resources. So there's a caregiving in place panel for people who really want to keep their loved one at home. There's a session on community resources to do that. Home care, adult day health care. We have staff from the Avenidas Rose Kleiner Center in Mountain View speaking. We have a new director there, Christina Lugo. People have a chance to meet her. We have a new director of Avenidas Village, Erica Thomas. People will have a chance to meet Erica and just learn about how all of these resources are mutually inclusive to keep somebody at home as long as they can be. But at some point, you can't keep somebody at home. So aging in place is a wonderful goal, but often you need to find a different place, and that is a care community. And so we have experts on senior care communities. Kay Sharborough of Senior Seasons will be speaking with a woman who has a company called Managing Moves, Cindy Hoffman, and they're experts on how do you find the right place and then navigate that moving day with somebody who's confused. That's an important session. And then the final session of the day is different and new, and we're partnering with Dennis Boyle of IDEO for people who really want to come in and learn design thinking strategies to problem solve whatever their caregiving issue is. We might just start with one main one, which is how do you take time off? Sounds simple. That's the hardest thing for a caregiver to do, is to take time off. So what would that look like? 30 people have signed up for that so far, 31 people. We think maybe 40 by the time it's November 10th we'll have signed up. And we'll divide into groups. I'm going to help in that session and really look at applying design thinking strategies to the family caregiver. So we're getting rid of the middle guy. We're getting rid of the startup, the tech experts, and we're going to let caregivers figure this out for themselves.
Figure out what they need.
Yeah, and learn this strategy.
Yeah.
You said you got the theme from feedback from caregivers who you're in contact with throughout the year. Is that?
Yeah, so creating a plan is hard because things change. They do change. So creating your master plan involves taking care of yourself, because that's what you can control. You have to take care of yourself. You have to renew your energy. This is significant. And then looking at on down the road, what are the likely services you will need, and planning for that. So this is really proactive planning and having options available too.
All right, well, the conference is again next Saturday. And what time does it start?
So it's We have early birds. So people start showing up at 7:30, 8 o'clock. We have coffee available. They talk. And it actually starts about 8:30, 8:45. Dr. Philip Cho is our keynote speaker, and he will be talking about continuity of care and taking care of self for the caregiver, connecting to community, and also staying socially connected.
Yes, yeah.
Which
and it
is
goes till
very
about
important.
3:30 in the afternoon.
Goes to 3:30 in the afternoon, and then the very last half hour of the day, we hope people will stay, come back to the main room. We're having Caregiver Cafe, we're serving coffee and chocolate, and I want to get feedback from people, and we're going to survey everybody, and I'm hoping people complete the surveys. I really want to learn from them if they achieved their objectives for the day, what they learned per session, if this provided them with useful information.
Sounds good. All right, Mitchell Park Community Center. People can find information at avenidas.org, and you said that people can walk in.
They can walk in, and they are welcome to call me.
Yes.
I answer my phone. I am at 650-289-5438. If you have questions, call Paula.
And the cost for the conference?
So the cost for the conference is minimal. It is $60 at the door if you're a walk-in, and now it's $55 per person.
Okay, in advance. Thank you so much for being here.
Thank you.
Paul. It's been great to hear from you and to learn a little bit more about caregiving. Well, that wraps up this edition of Behind the Headlines. To talk about caregiving and to read more about caregiving in Palo Alto, go to paloaltoonline.com. We have this week's Living Well section with the article about the conference and some of the topics there on paloaltoonline.com. We're on Facebook, Instagram, and Twitter, and please also hit subscribe or like below. And if you want to listen to Behind the Headlines instead of watch it, we've got a podcast now. You can find that on Apple iTunes or on Google Play. So we'll see you next week.